Now we'll discuss regarding ECG leads. So what is the difference between leads and electrodes? Leads are when electrodes are connected with wires for recording purpose, then these are called as leads. So leads are electrodes plus wires when used for recording purpose. So leads are nothing but electrodes when are connected with wires for recording. These are known as leads. Okay. So how the ECG leads has been used for recording of the ECG? See, there are 12 leads used for recording of ECG. Okay. Before that, we will see how the Enthoven's law has been discovered. What Enthoven has done, he put different electrodes on different limbs, right arm, left arm and left leg. Suppose he put electrodes on right arm, left arm and left leg, and for the right leg he used a neutral electrode. Okay, and based on the anatomical position he draws an Enthoven triangle. Okay, so the positive end of the electrode is attached to the positive end of the galvanometer and the negative end of the electrode is attached to the negative end of the galvanometer. So how he derived, suppose this is right arm, suppose this is left arm, the negative end, this is positive end, this is negative end, this is positive end, this is negative end, this is positive end. Okay, so the current will flow in this direction from right arm to the left arm. Okay, and he named as lead 1, and from left arm to the left leg the current is flown in this direction and he named as lead 3. Okay, and from left foot to the right arm current is flown in this direction, he named as lead 2. According to Kirchhoff's law, the net current flow in a closed loop is always 0. Okay, the net current flow in a closed loop is always 0. So lead 1 plus lead 3 plus lead 2 equals to 0. Later on, what he has done, he has just reversed the direction of this lead 2. Okay, so he has just reversed the direction of the current in this direction. Okay, what will happen? The negative end will be on this right arm and the positive end on the left leg. So what does it happen? If it will be reversed, then the derivation will be like this. Okay, so ultimately lead 1 plus lead 3 equals to lead 2. This is Enthoven's law. Okay. Now there are various leads which you are using. There are standard limb leads, then augmented leads, then unipolar precordial leads. Okay, So there has been because of its name, as its name, the name suggests, limb leads that has been put over the different limbs. Augmented leads, as I will discuss this later, and precordial leads because it is put over the chest, that's why its name is precordial leads. So what does the standard limb lead means? See, there are two types of in between that limb leads, augmented leads and precordial leads. There are two types of leads. One is unipolar leads and second one is bipolar leads. Okay, the bipolar leads are lead 1, lead 2, lead 3, whereas the unipolar leads are V1 to V6 and AVR, AVL and AVF. Okay, so the precordial leads along with augmented limb leads are unipolar leads and the bipolar leads are lead 1, lead 2, lead 3. So there are 3 bipolar limb leads plus 9 unipolar leads. So there are 12 leads total in a recording of ECG. Okay, so now we'll discuss how the leads has been placed. This is the image, the standard lead 1, limb lead 1. So here you can see that right arm, left arm, this is lead 1. The negative end of the electrode and the positive end, this is right arm, this is left arm. Okay, so it shows the potential difference between right arm and left arm. Okay, so the negative end is connected to the negative end of the galvanometer, the positive electrode is attached to the positive end of the galvanometer, it shows the deflection. Okay, so this is lead 1, whereas lead 2 is between right arm and left leg. Okay, the positive end is attached to the left leg, whereas the negative end is attached to the right arm, right? And lead 3, it's between the left arm and left leg. Similarly, the negative end is attached to the negative end of the galvanometer and the positive end is attached to the positive end of the galvanometer. Accordingly, I have been described as I have been described here. Okay, so this is all about standard leads because it records the potential difference between two arms, that's why it is called as bipolar limb leads. Okay, now unipolar leads are AVR, AVL and AVF. So initially what has been described, because of VR, VF and VL, initially the recording has been done accordingly like VR, VL and VF. It is not augmented. So how the recording has been done? So just see one image. Just see this. Why it is called as unipolar? Because one end of the electrode is put over the positive end of the galvanometer and the negative end of the galvanometer is passed through a high resistance electrical circuit. So literally no current flows over this circuit, and because of this type of circuit, the current flows in this circuit only, so it will record the potential at that point. Okay, so that's why although they looks bipolar, but it is unipolar lead. So to record potential at that point, unipolar lead concept came. Okay, to record the potential at that point only. So the unipolar lead concept came. So how the unipolar lead has been made? See, this is also a like type of bipolar lead, but one the negative end of the lead is connected or passed through a high resistance circuit. So literally in the negative circuit or negative end, no current flows. Okay, so what will happen? The positive end of the galvanometer is attached to the positive side, whereas the negative end is passed through high resistance circuit. Okay, so initially there is no absolute potential difference to be recorded, so that's why it records only potential at that point only here. Okay, so this is the circuit which I have already explained. Okay, so now what will happen if you put VR, VL or VF? Suppose we try to record on the right arm only, VR, then VR minus VR plus BL plus BF. Okay, so after this recording, the augmented or the recording is so much minimal, or the potential that has been recorded in the ACs is so much minimal that it literally records no recording. So that's why it has been augmented. So in the augmented, AVR has been done where negating the effect of the VR will be done. So VR minus BL plus BF. So AVR has been recorded like this. Similarly, the other AVL equals to BL minus BR plus BF, and AVF equals to BF minus BR plus BL. Okay, so similarly this augmented limb leads has been recorded like this, and the derivation is as follows. Okay, now where the unipolar chest leads are placed. Before that, I want to show one image regarding AVR, AVL, AVF concept, augmented leads. See, the lead AVR, look here, AVR means it records the potential at right arm only. So the recording arm will be placed on this, where the positive end is connected to the positive end of the galvanometer, where from left arm and left leg the recording has been summated and passed through high resistance circuit. Okay, so this is VF and VL. Okay, so this is the reason why we are calculating or looking the potential at that point only on the right arm. Similarly, in case of AVL, we are recording on left arm, so it is passed through, the positive end is connected to the positive end of the electrode on the galvanometer, whereas the negative end is connected right arm, left foot. So both are passed through high resistance circuit, so literally no current is flowing, so it only records the potential at left arm only, right? In case of AVF, the left leg is attached to the positive end of the galvanometer, whereas the negative end, both right arm, left arm and right arm is passed through high resistance circuit, which is connected to negative end of the galvanometer. So it will record only the potential at left leg only. Okay, so this is all about augmented limb leads. Now the placement of unipolar chest leads. So what is the necessary of this test? Let's see. The leads 1, 3 and lead 2 are records the potential in vertical directions. It records the potential or potential difference across the vertical directions, whereas for horizontal plane across the chest it should be recorded, some recording should be there. So for vertical recording, recorded leads has been placed, and they have been placed so much so accordingly, like this. See the B1, B2, B3, B4, B5 and B6. So how these have been placed? The V1 is placed over 4th intercostal space in the right side, just adjacent to the sternum. Okay, the B2 is placed in the same 4th intercostal space in the left side, just adjacent to the sternum. Okay, now the question regarding that, how will detect the intercostal space? So the second intercostal space, how it will be appreciated? See, the sternal angle, otherwise known as angle of Lewis. Okay, the sternal angle where the second intercostal cartilage attached. Below the second rib is the second intercostal space. Below the second rib, second intercostal space. Okay. So the sternal angle, which is otherwise called as angle of Lewis, corresponds to second intercostal cartilage. Okay, below the second rib, where the second rib is attached to second intercostal cartilage at the angle of Lewis, below that is the second intercostal space. It is also the site of needle puncture while doing needle puncture in tension pneumothorax. Site of needle puncture during tension pneumothorax. Okay. Now the B4 is placed in the mid clavicular line in the 5th intercostal space. The V4 is placed in the mid clavicular line in the 5th intercostal space, whereas the B3 is placed in between B2 and B4. Okay, the B3 is placed in between B2 and B4. The B5 is placed in the same horizontal row, horizontal plane, in the same horizontal plane over anterior axillary line. Okay, over anterior axillary line, whereas the B6 is placed in the same horizontal plane over mid axillary line. Okay, so these are the placement of the B1 to B6 accordingly, where placing the electrodes starting from the right border of the heart, from the covering the septum to the left border of the heart. So this will record the electrical potential across the horizontal plane of the heart. Okay, you can see here, right? This is the plane or site of recording. Now coming to extended unipolar chest leads. So what do you mean by extended unipolar chest leads? The B7, B8 and B9 are the extended unipolar chest leads. The B7 is placed in the fifth intercostal space in the posterior axillary line. The B7 is placed in the fifth intercostal space over posterior axillary line. The B8 is placed in the fifth intercostal space in posterior scapular line. The B8 is placed in the fifth intercostal space over posterior scapular line, whereas the B9 is placed over fifth intercostal space in the left border of the spine of scapula. Okay. The fifth intercostal space is placed in the left border of the spine of the scapula. The B9 is the mostly placed lead. B9 is the mostly placed lead for detection of posterior wall MI. So while suspecting the posterior wall MI, you are doing or placing the lead B9 over the fifth intercostal space, okay, posteriorly. Now one point to remember, lead B4R, lead B4R is placed in fifth intercostal space in the right midclavicular line. So this may ask as MCQ. Lead B4R is placed in the fifth intercostal space in the right midclavicular line. Okay, now we want to see different images. The B1, B2 left side, B3, B4 for interventricular septum, then B5 and B6 is the right side, this is the left side. So accordingly B1 to B6 are placed from the right side of the heart to the left side of the heart covering. If we are suspecting the posterior wall MI, we are placing B7, B8 and mostly B9 will be placed posteriorly. Okay. Now coming to the concept of electrical axis. Electrical axis. What do you mean by axis? Axis denotes mean the direction of flow of current. The axis denotes the mean direction of the flow of current through the heart. Okay, the axis denotes the mean direction of the flow of the current through the heart. It is determined by anatomical position of heart and mean direction of flow of current. So the axis are always measured by the anatomical position of the heart. Suppose the heart is moved towards little bit deviated towards right side, towards left side, then the axis will change. Then the mean direction of the current of the flow will also determine the electrical axis. Normally what will happen, the electrical axis is right to left and from superior to inferior. Okay, normally the electrical axis is from right to left and from superior to inferior in this direction. So it is from superior to inferior and it is from right to left side depending upon the position of the heart. Okay, suppose this is the heart, then it is from right to left side. So now we will see one diagram. This is the net electrical axis of the heart. Yes, I can see here this is the net electrical axis. It is from superior to inferior and from right side to left side. Okay, now how will you determine different cardiac axes? Determining axis. Here the concept of hexaxial system comes to role. So before that I want to draw that diagram again. This is lead 1, right? This is lead 2, this is lead 3. Okay, if you extrapolate this diagram, it will looks like this. So now you can join the dotted line forming the hexaxial system. So this is lead 1, this is lead 2, this is lead 3. Okay, now erase every other thing. Now you have to determine how the electrical axis or what is the axis of the heart. Now determining axis, we have to extrapolate the Enthoven's triangle. This is lead 1, this is lead 3, this is lead 2. If we extrapolate the different leads, then accordingly the hexaxial system comes into play. Now erase everything. Now you can know this is lead 1, this is lead 2, this is lead 3. So the lead 1 is exactly placing over 0 degree, the lead 2 is the resultant, and the lead 3 is beyond 90 degree. This is 90 degree. Okay, whereas if you are putting the augmented leads, then exactly over the 90 degree AVF lead will falls. Okay, so the axis is from minus 30 degree to plus 110. This is normal axis. Okay, the net electrical axis falls on 59 degree exactly over the lead 2. So lead 1 plus lead 3 equals to lead 2. Okay, so it is normal. If the axis or net electrical axis falls in between minus 32 plus 110, then it is normal axis. If it is beyond minus 100, beyond minus 30, then it is left axis deviation. Okay. If it is beyond 110, then it is right axis deviation. Beyond 110, right axis deviation. Okay, and if it falls on this quadrant, then it is extreme axis deviation. Okay, so the concept of quadrant over this axis comes into scenario by drawing the hexaxial system. If the axis, net electrical axis, falls beyond minus 30, then it is left axis deviation. If it falls beyond plus 110, then it is right axis deviation. If it is between minus 30 to plus 110, then it is normal axis. Okay, normal, right axis, left axis, then extreme axis. So if it falls in this quadrant, then it is extreme axis deviation. So we'll redraw this diagram. Minus 30 plus 110, this is normal. Beyond minus 30, it is left axis deviation. Beyond plus 110, it is right axis deviation. And if in this quadrant the axis, resultant axis, falls, then it is extreme axis deviation or northwest axis deviation. It is otherwise named as northwest axis deviation. Now, how will you calculate the axis from an SEG? Calculation of the axis. The R minus S in lead 1, if it is positive, the R minus S in lead AVF or lead 3, if it is negative, then it is left axis deviation. Then the R minus S wave in lead 1, if it is negative, the R minus S in lead AVF or lead 3, it is positive, then it is right axis deviation. The R minus S in lead 1 is negative, the R minus S in lead 3 or AVF is negative, then it is extreme axis deviation or northwest axis deviation. So let us discuss with the ECG paper directly while discussing the concepts from here. Okay. So now tell me, in lead 1, what is the R minus S? The R wave, this is the QRS complex, the R wave is plus 5, S wave is minus 1. So R minus S in lead 1 is R minus S plus 5 minus 1 equals to plus 4. That means it is positive. Okay. In lead 3, the R minus S is negative, or in AVF also the R minus S is negative. Okay, so if the R minus S is positive in lead 1 and the R minus S in lead 3 is negative in lead 3 or AVF, then it is left axis deviation. So this ECG shows it's a left axis deviation. Okay. Now coming to the concept of another ECG. See here in the lead 1 the R minus S is negative, the R is this one and the S is more negative. So the R minus S is negative. In lead 3 the QR S, okay, the R minus S is positive. Okay, so if the R minus S is negative in lead 1 and the R minus S is positive in lead 3 or AVF, then it is right axis deviation. Okay. Now we will look after another concept. Extreme axis. Here you can see the lead 1 R minus S is negative, in AVF the R minus S is negative also. Okay, so in the hex axial system it falls in this quadrant, negative and negative. So in the hex axial system we can record like this, in this manner. If the R minus S in the lead 1 is positive, so the positive direction in this direction. In the lead AVF the R minus S is also positive. Okay, so the resultant will fall in this direction, which is normal. Okay, suppose the R minus S is positive in lead 1, whereas the R minus S in AVF is negative in this direction. So the resultant may fall beyond minus 30. So this is left axis deviation. Okay. Then another concept, if the R minus S in lead 1 is negative in this direction and the R minus S in this direction is positive, so the resultant will be in this direction, which is beyond plus 110. It is right axis deviation. Okay, the R minus S is negative here and the R minus S is AVF is negative in this direction. Negative here, and the R minus S is negative here in AVF. So the resultant will be like this, in this manner. Okay, so this falls in extreme axis. Okay, so this is the concept of hexaxial system, where we can calculate the hexaxial system, we can calculate the axis of the ECG. Now what are the causes of left axis deviation? Note down one by one. WPW syndrome, Wolff-Parkinson-White syndrome, left anterior hemiblock, okay, left ventricular hypertrophy, inferior wall MI, then cardiac pacing, then congenital heart disease. particularly ostium primum, AST, and tricuspid atresia. Okay, so these are the causes of left axis deviation. Now coming to the causes of right axis deviation, the commonest cause being COPD, chronic lung disease, then mitral valve disease, then pulmonary embolism, then WPW syndrome, Wolff-Parkinson's-White syndrome, then left posterior hemiblock, okay, then anterolateral wall MI, then the most important is right axis deviation is common in children, or it is normal or physiological in children and in thin young adults. Okay, so in case of thin young adults and in case of children, normally the right axis deviation is a normal finding. I have already explained in one video earlier the why the normal in case of children right axis deviation has been seen. Okay, then coming to the causes of extreme axis, the causes of extreme axis are complex congenital heart disease, dextrocardia, right sided heart, dextrocardia, placed rhythm, then multiple MI. Okay, so the causes of extreme axis are complex congenital heart disease, dextrocardia, placed rhythm, and multiple MI. These may come as an MCQ in INICETs. So the different various causes of left axis deviation, right axis deviation, extreme axis deviation has been discussed. Okay.